Hi, everybody. Welcome to Up to Speed Live. It's Happy Monday, October 4th. It is October. So much happening. I'm Diana Alvear, and I do want to call attention to my shirt because, by the way, October is Breast Cancer Awareness Month. So we're going to be talking about all sorts of stuff today. By the way, though, we cannot let Friday's Huddle go because, people, it was a must-see event, okay? The virtual set, the event was awesome, and you could feel the energy no matter where you were. What better way to kick off the fourth quarter than with a ton of energy and an audience full of V-teamers, and they kept hitting that fire emoji. It was awesome. If you didn't watch it yet, listen. It takes less than 30 minutes to do so, and you're going to be so glad you did. So check out the link in today's story. All right, let's talk about some other awesome news. Our business customers have some new choices based on their feedback. Business Unlimited 2.0 is the next step in the evolution of Verizon's unlimited offering to business customers with more for less, including mobile hotspots on every plan option, increased premium data, and all available on our 5G network. Business marketing leader Jeff Dietl says this is the perfect time for these great new plans.
September obviously started off for us with our successful launch of Small Business Days. We followed that up, of course, with the iPhone 13 announcement and the iPhone 13 resulting pre-orders and then effective launch. And now we're capping off the month and the quarter with Unlimited 2.0. Reason why it's so important for us is it's a follow-on for us to continue to work to get the feedback from our customers, get the feedback from our frontline reps, figure out what's working, make some adjustments to the existing pricing that we have in the marketplace so that we can then go out and capture even more share by satisfying even more customers, encouraging even more customers to switch over to us. We're very excited about the fact that these price plans have launched in time for us to execute on it during the full 90 days within the fourth quarter. So that's why we're so excited about the fourth quarters. These plans, coupled up with the most powerful network, as well as the most attractive device offers in the marketplace right now, is a recipe for huge success.
And a recipes for success is my favorite. Thank you, Jeff. Congrats to the team on this successful launch. Just another reason customers should choose Verizon. So it's Customer Service Appreciation Week. Our V-Team culture is very deeply rooted in customer centricity. We're always talking about it. And no one understands better what it takes to make our customers smile every day than those on the front lines. So every year during the Customer Service Appreciation Week, we spend the first full week in October celebrating all of our customer-facing employees and those who support them every day because they matter as much as our customers do. We wouldn't be able to do what we do without you. So V-Teamers across the globe, our customer service, inside sales, our retail V-Teamers, frontline techs, and everyone who works behind the scenes to make it possible for them to do their jobs, we thank you. You're Verizon's cheerleaders, and today we are cheering for you. Okay, so let's turn to something that we have been discussing for a while. We know that some of you have some questions about the COVID-19 vaccines and more. Now, personally speaking, I have been vaccinated. I talk about this a lot. It was a huge relief for me. I have little ones and I wanted to keep them as safe as possible. And not only that, big bonus, I was able to see my mom and other family members that I had not seen for months without worrying about their health. So my colleague and friend Rebecca Laming sat down with Dr. Jessica Grubb. She's Anthem National Accounts Medical Director, who is board certified in infectious diseases. Dr. Grubb is sharing facts on the COVID-19 vaccines. She's addressing some of the questions that we have seen flagged by our V-Teamers. We want to make sure that you know how to get the information that you need from public health authorities and medical professionals to help you stay healthy and safe.
Dr. Grubb, thank you so much for being here today, and we are just so excited to speak with you and really understand the facts from your perspective as a medical professional. So to get started, what are the benefits of vaccination against COVID-19, and why do medical professionals support it?
So first of all, thank you very much for inviting me to speak today. I want to start by emphasizing that the information that we're going to discuss today is current for October 1st, but as we know from the last almost 2 years, recommendations and data is going to continue to be collected and reviewed. And first of all, too, I know we're all exhausted of COVID, but unfortunately the virus is still wreaking havoc across the country. From the CDC, as of the end of September, cases are up to 43 million, and there's over 691,000 deaths. In 2020, life expectancy in the United States declined overall by a year and a half. And we just heard recently that over 1 in 500 Americans have died from COVID-19 since the first reported infection. Unfortunately, with the Delta surge this fall and late summer, we've seen so many more people, especially young people, ending up in the hospital or even dying. And with this new Delta strain, we're seeing that it appears to be more infectious and may possibly have up to 1,000 more viral particles in the throats of infected people than with previous types of variants. So with all this extremely worrisome news, there is one important piece of good news, which is that the vaccines are safe and working extremely well against COVID-19, including the new variants like the Delta. What is especially clear is that the vaccines are extremely effective in preventing hospitalization and death. In other good news, we have seen recently that a lot more people are getting vaccinated as they see the Delta surge, not only with older people, but also younger people also getting critically ill. I want to note that no vaccine is ever 100% effective, and we have heard fully vaccinated people can still get COVID-19, and that's known as a breakthrough infection, but it is much, much, much less common than people who are unvaccinated. We also see that vaccinated people tend to spread the virus for a shorter time than unvaccinated people, which is also so important in preventing new infections.
So let's get into the details on what's actually in the vaccine and what makes it effective in combating COVID-19.
So first of all, the vaccine ingredients are going to vary by the manufacturer, but I do want to cover some of the key questions that I know a lot of people have. None of the vaccines contain eggs, latex, or preservatives. Receiving the COVID-19 vaccine will not make you magnetic. COVID-19 vaccines do not contain ingredients that can produce an electromagnetic field anywhere at the site of your injection at all. All COVID-19 vaccines are completely free from metals. They are also free from microelectronics, electrodes, carbon nanotubes, or nanowire semiconductors. And the 3 FDA-authorized COVID-19 vaccines do not contain fetal tissue, implants, microchips, tracking devices, or anything that could change your DNA. These vaccines, importantly, they help our bodies develop immunity to the virus that causes COVID-19 without us actually having to get the illness. COVID-19 vaccines also help you, and we've seen this so much recently, from getting seriously ill, even if you do get infected with COVID-19.
What are the differences among the 3 approved vaccines? So we have Johnson & Johnson, we have Moderna, we have Pfizer. So what are the 3 differences amongst those?
Okay, so and as you point out, right now we're very lucky that we have 3 available vaccines that either have emergency use authorization. And one important difference is that Pfizer just recently got full approval for adults, the Pfizer-BioNTech. And we do expect that others may get full approval soon. But right now, at the end of September, early October, just Pfizer. So Johnson & Janssen is a viral vector vaccine. These are, they use a modified version of a different virus called the vector to deliver instructions to our cells. So the benefit of these viral vector vaccines, like all vaccines, is those vaccinated gain protection without ever having to risk the serious consequences of getting sick with COVID-19. So Pfizer, BioNTech, and Moderna are different types. They're messenger RNA vaccines, and they also protect against infectious diseases. To trigger an immune response, many vaccines use the weakened or inactivated germ into our bodies. And for these vaccines, there's no actual germ or virus. Instead, they teach our cells how to make a protein or even just a piece of protein that triggers that immune response against our bodies. And that immune response, which produces antibodies, is what protects us from getting infected if the real virus enters our bodies. Despite the name, which does, I think, worry some people, these vaccines do not interact with our own DNA in any way. The messenger RNA never enters the nucleus of the cell, which is where our own DNA, our genetic material, is kept. The vaccine also does not contain live or any inactive portion of the COVID-19 virus. It absolutely cannot give you the disease itself. And again, I want to point out Pfizer is now fully approved for adults. The other vaccines we just talked about have emergency use authorization. This may change in the near future. I also want to take this moment to say that I have been vaccinated, my entire family, including my parents and all three of my children, including my 12-year-old, and we were vaccinated, honestly, as soon as we were able to.
Some have raised questions about how quickly the COVID-19 vaccinations were developed. What can you tell us about the processes that led to the vaccines being authorized for use?
Okay, and another great question. So the COVID-19 vaccines were developed faster than past vaccines, and this is due to real-time research sharing among scientists. We had advanced funding, which was made available to vaccine developers, and also the use of already existing technology. The COVID-19 vaccines were actually built on decades of research and experience. Researchers have been studying and working with the messenger RNA vaccines for decades. So while the speed of development was important because we had a pandemic and obviously we wanted to get these as quickly as possible, safety was not sacrificed. These vaccines, all of them, were tested on tens of thousands of people, and they met the usual safety and effectiveness standards required for that emergency use authorization. They were also reviewed and approved by multiple independent advisory panels. And, we had this increased collaboration and funding, which allowed vaccine developers to work really quickly during the pandemic, but not cut safety corners. And I want to also mention that right now, over 390 million doses of COVID-19 vaccine have been given in the United States from December 14th through the end of September, and there is ongoing safety monitoring, and honestly, just such a extremely small amount of adverse events when you consider how many hundreds of millions of vaccines have been administered.
So there have been reports of side effects with COVID-19 vaccines. What does the published data tell us about the prevalence of these conditions, and what's the likelihood of someone developing them after receiving the vaccines?
So I do want to first of all mention that these vaccines often have side effects, and that's common among all vaccines, and it's a normal sign that your body is building protection. These may be pain, redness at the site. People may also get muscle pain, chills, fever, and nausea, and they may short-term affect your ability to do your usual activities, but generally for most people, they go away in a few days. Obviously, if you have serious side effects, and you should definitely talk to your physician, but again, these are extremely, extremely uncommon. So to date, the systems that are in place to monitor the safety of these vaccines have found only 2 serious types of health problems, and both of which are extremely rare. The first is anaphylaxis, which is a severe allergic reaction, and it was very rare. And this is also can be found against other vaccines, even foods. That is, I don't want to say expected, but there is some risk of severe allergic reaction for a very few amount of people in really almost anything we take. The other thing that they found is it's called thrombocytopenic syndrome, thrombosis with thrombocytopenic syndrome, and that is after vaccination only with the J&J Johnson & Johnson Janssen. And so there's a risk for a rare, but it could be serious event, blood clots with low platelets. And they found that especially in women younger than 50 years old, and they should be aware of their increased risk and consider taking one of the other vaccines and discuss that with their provider. It occurred at the rate of about 7 per 1 million vaccinated women between the ages of 18 and 49 years old. For women that are older and men, the risk is even more rare. And again, that was only noted in one type of vaccine. There have been reports of myocarditis and pericarditis in teens and young adults. And that's been reported after, especially their second dose of the 2 messenger RNAs, the Pfizer-BioNTech and the Moderna. These have been extremely rare, and there's not a definite correlation between the vaccines. That this is being closely monitored, and I think we'll know more information soon about this. I did want to point out that there's at least one study that showed you actually have a higher risk of myocarditis from COVID itself than from the vaccine. So I think that's really important to note. when we're looking at serious side effects, that again, 390 million vaccines total. We've had 184 million people completely vaccinated. So these side effects are extremely rare. We also know anytime you're talking about hundreds of millions of people that we're going to have some events that are just unfortunately part of everyday life. So one of the things that's very important is to separate whether this is just a random occurrence with that many millions of people, or if it's from the vaccine itself.
The next question you referenced earlier, but one of the questions we see time and again is around how vaccinated people can still get COVID. Do you believe people should get vaccinated if it doesn't fully protect them from contracting COVID-19?
This is such an extremely important question, and absolutely people should still get the vaccine, even if we are seeing these breakthrough infections. And the main reason, and I honestly cannot emphasize this enough because it's so important to all of us, is that the vaccines are preventing hospitalizations and deaths, including, as I mentioned, in younger people. Hospitalizations are currently almost all in unvaccinated people. This is a recent study from CDC, and it was from May to July, so it's including the Delta, or almost primarily the Delta, and that looked at 43,000 infections. The infection rate was 5 times higher in unvaccinated people, and the hospitalization rate was 29 times, almost 30 times higher in unvaccinated people besides compared to vaccinated people. And then the MMWR, which is through the CDC, they actually just did another study looking at 13 jurisdictions, states, and health departments, and that also showed that infection is 5 times more common. Hospitalizations and deaths are 10 times more common in unvaccinated versus vaccinated people. So, and this is not my quote, it's someone else's, but I completely agree with it. A vaccine is like a seatbelt. It is not going to prevent a car crash. It will not prevent you from completely getting COVID-19, but it's probably going to save your life if you have that vaccination.
We see information that people previously infected by COVID-19 may have built up antibodies and immunities against the virus. Do you believe that those people should still get vaccinated?
Yes, you should still be vaccinated regardless of whether you've already had COVID-19. So right now, research has not definitively shown how long you're protected from getting COVID-19 again after you recover from the illness, and vaccination helps protect you even if you've already had COVID-19. So there's emerging evidence that people get better protection by being fully vaccinated besides having COVID-19. And we had one recent study that showed unvaccinated people who already had COVID-19 are more than 2 times as likely as fully vaccinated people to get COVID-19 again. So at this point, absolutely you should still get vaccinated if you've had it in the past. I do want to point out one thing, that if you were treated for COVID-19 with monoclonal antibodies or convalescent plasma, you should wait at least 90 days before getting the vaccine. And absolutely, and this is true in any case, please talk to your doctor if you're unsure about any treatments you received, or just in general, if you have questions about getting the COVID-19 vaccine.
As you mentioned, it's October 1st. We're in the swing of the school year, and schools resumed with many students back in the classroom for the first time in over a year. And we continue to hear about infections in various districts and causing even some classes or schools to shut down. So how have COVID-19 vaccines been authorized for children?
So at this time, children ages 12 to 17 years can receive the Pfizer-BioNTech COVID-19 vaccine. And this may change in the near future, but right now, the children at those ages are eligible.
If someone is around a person who is immunocompromised, why do you believe it's important to get vaccinated?
So people who have a condition or who are taking medications that can weaken their immune system may not be fully protected, even if they're fully vaccinated. And we'll talk about that in a second about the booster shot. But they should continue to take all precautions that may include wearing a mask until advised otherwise by their healthcare provider. And for this group especially, I would definitely say talk to your provider if you have any questions about your risk of COVID. For this reason, because immunocompromised people may not respond as well to the vaccines, and they're already at higher risk for more serious infections, if you're around someone who's immunocompromised, it is especially important for you to get vaccinated yourself to reduce the risk of people getting COVID-19, and it may also reduce the risk of spreading it to your loved ones who are immunocompromised.
And why are some vulnerable populations getting a booster shot? You just mentioned the booster shot. And what have health authorities said about whether an extra dose is needed?
So the CDC now is recommending that people ages 65 years or older, people who are 18 years or older in long-term care settings, and people aged 50 to 64 years with underlying medical conditions should receive that booster shot. And other groups may receive a booster shot based on their individual risk and benefit. And again, I think this may change in the near future as we get more information about how long the original vaccines are going to work. We do see, and studies show, that after getting vaccinated against COVID-19, protection against the virus may decrease over time, and people may be less able to protect, especially against the Delta variant. I do want to emphasize that overall, for younger people, the vaccines are extremely effective, even as very long term. But we are seeing some evidence that among the older people that effectiveness may decrease over time.
And if I'm fully vaccinated and haven't received a booster, am I still considered fully vaccinated?
So at this time, the CDC considers 2 doses of the messenger RNA or the 1 dose of Johnson & Johnson, you're fully vaccinated. But again, this is an evolving area. It may change in the future. And as we just discussed, if you're in that certain group that is recommended to get a booster, you should, definitely, discuss with your provider and consider getting a booster because you may be at higher risk.
And what are the other misconceptions around the COVID-19 vaccine that you think are important to address?
So thanks for giving me time to talk about it. There are 3 things I would like to mention. So right now, the COVID-19 vaccination is recommended for everyone 12 years of age of older, and that includes people who are trying to get pregnant now or might become pregnant in the future, as well as people who are currently pregnant. Currently, we have no evidence that shows that COVID-19 vaccines are causing fertility problems or any problems trying to get pregnant in women or men. I also want to highlight the importance of getting information from a trusted source. Before considering vaccine information on the internet, check that the information comes from a credible source and also is it updated on a regular basis. And I also just want to end by emphasizing the importance of a flu vaccine, especially at this time of year. And in terms of COVID-19 vaccines and other vaccines, you absolutely can get the flu vaccine and the COVID-19 vaccine at the same time. Experience with other vaccines has shown that the way your bodies develop protection, which is that immune response, and getting vaccinated is really the main way we can protect our bodies and ourselves and our community against COVID-19, which is unfortunately continuing to be such a terrible pandemic across the United States.
Well, thank you so much, Dr. Grubb. We really appreciate your time. We appreciate you sharing the facts and the data that's out there. And we just thank you so much.
Thanks.
And thank you so much, Rebecca and Dr. Grubb. As you can see, some really valuable and interesting information there. Okay, before we go, don't forget tonight, check out the latest vignette about 5G Home on Smart Home Nation on the FYI network. You can catch it at 10 p.m. Eastern and 7 p.m. Pacific. This is Andy's Big Break, and this show is going to be exploring the state-of-the-art smart houses with that wow factor, which of course makes 5G Home a perfect fit. Thank you so much for hanging out with me today. We're starting the week strong. I'm Diana Alvear. Until next time, you're up to speed.